Your pain is not a diagnosis, it is a signal. Most of the medical industrial complex wants to silence that signal. They use an assembly line of insurance-approved injections and palliative procedures that leave your underlying terrain untouched. This is reactive, not restorative. If you are a high-agency individual who is tired of being a line item in a billing department, we should talk. Welcome to Regen MD. I am Dr. Gurpreet Padda. For over 30 years, I have operated at the intersection of trauma surgery, anesthesiology, and metabolic health. I started in the trauma bays of Cook County. I moved into anesthesiology, which in French is known as reanimation. That is exactly what we do here. We do not just manage decline, we reanimate the human system. Our clinic is the gateway to regeneration. Patients fly in from around the world to access a level of clinical mastery that the local assembly line cannot provide. We believe in metabolic sovereignty. This means transitioning from a passive consumer of pharmaceutical interventions to an active controller of your own biology. The modern healthcare system thrives on the management of chronic misery rather than its cure. It treats symptoms as isolated events rather than systemic failures. We are living in a biological mismatch. Highly processed carbohydrates and seed oils have created a metabolic environment where your cells can no longer hear the signals of health. These oils and sugars make your cell membranes rigid. When the membrane is stiff, the insulin receptors cannot function. This is the structural origin of insulin resistance. This mismatch leads to insulin resistance, the primary driver of meta-inflammation. This is the root cause of chronic pain, obesity, and even addiction. While standard medicine waits for your hemoglobin A1C to hit 6.4, we target levels below 6.0. We reverse insulin resistance to reduce all-cause mortality. By targeting a sub 6.0 A1C, we are not just managing diabetes. We are permanently editing approximately 8% of your genetic expression for longevity and health. In the conventional system, you often receive a steroid shot based on where you say it hurts. That is a guess. At Regen MD, we do not guess. We use high-precision imaging technology like musculoskeletal ultrasound to visualize soft tissues, nerves, and blood flow in real time. We see what others miss. We utilize fluoroscopy to ensure every intervention is a calculated strike. This allows us to navigate the spine and joints with precision that an office guest cannot match. When we deliver orthobiologics like platelet-rich plasma or bone marrow concentrate, we are not just putting fluid in an area, we are placing a biological payload. Platelet-rich plasma uses your own biology to help injuries heal faster. This is disease-modifying medicine. We are restoring the structural integrity of your body. Orthobiologics should be a first-line treatment for musculoskeletal care. In 5 years, this will replace many toxic steroids and invasive surgeries. But orthobiologics only work if the environment is right. If your cellular soil is toxic or inflamed, local tissues cannot heal. We must fix the metabolic terrain first. We use photobiomodulation, light therapy, to communicate directly with your mitochondria. Light is not just brightness, it is information for your cells. By using specific wavelengths of light, we reduce systemic inflammation and increase the energy production your cells need to repair themselves at the source. This is not some vague wellness concept. It is hard science based on the physics of cellular respiration and the reduction of oxidative stress. We further optimize your terrain with advanced peptide therapy. Peptides like BPC-157 and TB-500 are signaling molecules that tell your body to repair tissue and modulate the immune system. BPC-157 is legendary for tendon and ligament repair, while other peptides restore hormonal balance, especially when paired with a ketogenic or carnivore lifestyle. Most clinics tell you that decline is just part of aging. That is a lazy answer. We see it as a loss of metabolic integrity. We fix the signals that have drifted. When we integrate precision hormone management with targeted peptides, we create the optimal biological stage for our regenerative procedures to succeed. I also train other physicians in this model. We are scaling metabolic health because the current system cannot solve the crisis of chronic illness with hospital-style reactive care. Our vision involves deploying 20,000 to 30,000 health coaches to scale these interventions. We are moving from a doctor-centric model to a community-wide metabolic restoration. We are integrating AI to handle clinical data and compliance. This allows us to remain viable within the medical legal system while providing truly non-traditional restorative care. Through the Society of Metabolic Health Practitioners, we are building a political voice. We must stay engaged with the system to change it from the inside out. We use group coaching to bridge the gap between clinical advice and daily habit. We teach you how to use a crock pot and an air fryer to reclaim your health in your own kitchen. Regeneration is a 24-hour-a-day process. Clinical procedures provide the spark, but your daily metabolic habits provide the fuel for genuine structural restoration. In addiction medicine, we use hedonic substitution theory. By fixing the underlying meta-inflammation, we restore your body's natural endorphin production. When the biological mismatch is resolved, the craving for narcotics diminishes. We are using metabolic health to break the cycle of chemical dependency. Conventional pain management is built for insurance compliance. It is built to keep you on the hedonic treadmill of symptom suppression. We are built for outcomes. We are the high-precision laboratory for functional truth. We provide the patient who demands analytical precision with the tools to reclaim their life. Our environment is where MBA-level efficiency meets the polymathic mastery of 30 years of clinical experience. We optimize every variable of your health. We provide the data and the interventional excellence, but the goal is always to return power to you. You are the ultimate authority over your own biology. When you fly into St. Louis and step into Regen MD, you are entering an environment where clinical experience meets analytical precision. Welcome to the Gateway. Stop being a victim of a broken model. Your pain is a scream from a system out of balance. Visit Regen MD and schedule your consultation today. Take back your sovereignty. Your body is information. It is time you started listening to what it is actually saying. Welcome to the Gateway of Regeneration.